I want to speak to you with complete sincerity and clarity about a topic that generates doubts for many older men. What effects does masturbation have when suffering from prostatitis in old age, and whether or not it is advisable to do it? I will explain it in a human, practical way and with clinical experience in mind, so that you can make informed decisions and, if necessary, speak to your doctor with strong arguments. The first thing to understand is that the word prostatitis encompasses different situations. Sometimes we talk about acute bacterial prostatitis, which is a real infection of the prostate with fever, significant pain, and risk of complications. Other times we talk about chronic bacterial prostatitis, which are repeated episodes of infection. And the form we see most frequently in consultations with older men is chronic pelvic pain syndrome, or chronic non-bacterial prostatitis, which is a combination of pain, urinary discomfort, and pelvic tension without a clearly identifiable bacterium. The recommendations change depending on which one we are talking about, so the first step is to identify the type with your urologist. If you have acute prostatitis with fever, chills, intense pain, and difficulty urinating, the rule is clear. It is not the time for sexual activity or masturbation. In that scenario, the priority is to receive appropriate antibiotics and medical care because there is a risk of the infection becoming complicated. Forcing the area with genital manipulation or intense stimulation can increase pain, favor the spread of the inflammatory process, and delay recovery. In the acute phase, the sensible thing is rest, treatment, and returning to sexual activity only when the doctor authorizes it. In the case of chronic bacterial prostatitis, the decision is more nuanced. If the prostate has bacteria and there are recurrent episodes, masturbation is not prohibited per se, but it is advisable to do it with caution. Often, treatment includes prolonged cycles of antibiotics and measures to improve prostatic drainage. In some men, regular ejaculation helps to empty secretions and reduces the feeling of congestion, so it can be a useful complement. In others, intense or too frequent stimulation can irritate and cause discomfort to reappear. The practical idea is to try it in a controlled way. Reduce the intensity, space out the sessions, and observe the sensation it leaves the next day. If you notice increased pain, blood in the urine, or worsening symptoms, suspend and consult. The most common and complex scenario is chronic pelvic pain syndrome. Many older men come to the consultation with perineal pain, a feeling of prostatic heaviness, and intermittent urinary urgency without routine cultures showing bacteria. In this group, masturbation can be a double-edged sword. For some patients, regular ejaculation functions as a kind of relief that reduces prostatic congestion, helps relax the pelvic floor, and improves sleep and mood. For another group, intense masturbation or aggressive technique generates local inflammation and worsens pain for hours or days. That is why the general recommendation, based on clinical experience, is to personalize. Try a gentle practice with lubrication if necessary, avoiding vigorous technique and observing the response in the following 24 to 72 hours. If the discomfort decreases or stays the same, it is reasonable to maintain that pattern. If it worsens, the strategy must be changed. There are practical details that can make a difference and are not always mentioned. Maintain good hygiene before and after. Empty the bladder after ejaculating to reduce the reflux of secretions into the urethra and bladder. Avoid perfumed or irritating products on the glands and in the urethra. Use water-based lubrication if friction is high, because local irritation is usually a trigger for recurrent discomfort. Also, avoid excessive alcohol and caffeine in the hours before, as they increase the feeling of urgency and bladder sensitivity. If you have chronic constipation, fix it, because compact stools push the pelvis and worsen prostatic congestion. From a rhythm perspective, many specialists advise moderation. If before prostate kiss you masturbated daily, and now you have discomfort, try spacing it out to 2 or 3 times a week and observe. If there is no worsening, you could maintain that frequency. For some men, masturbation every 2 or 3 days is ideal because it maintains prostatic circulation without causing overload. Even so, there is no single rule. Listen to your body and adapt. It is also important to work on the pelvic floor. Chronic tension in the perineal muscles is a key factor in chronic prostatitis. Learning to relax and contract correctly with the help of a specialized physiotherapist often greatly improves tolerance to sexual stimulation and reduces pain. In many cases, combining pelvic exercises, warm sitz baths, gentle perineal massages, and moderate masturbation produces better results than just limiting sexual activity. Another point that is not mentioned enough is the emotional component. Prostatitis and pelvic pain affects self-esteem, the relationship with a partner, and quality of life. Masturbation can be a tool to maintain contact with one's own sexuality and manage anxiety, but if the practice becomes a source of guilt or more anxiety, it must be addressed with a sexual therapist or psychologist. Talking with your partner, explaining what hurts, and temporarily changing roles and practices can alleviate pressure and improve recovery. There are clear signs that indicate that you should immediately suspend masturbation and seek help. If after masturbation fever appears, blood in the urine or semen, intense pain that does not subside with usual analgesia, inability to urinate, or a notable worsening of the quality of sleep or mood, consult urgently. These changes may indicate an infectious complication or a process that requires adjustment of treatment. A common example I usually share in consultation: a 70-year-old patient with chronic pelvic pain was avoiding all types of stimulation for fear of worsening it. As a result, he was anxious, sleeping poorly, and his relationship was suffering. I proposed a controlled test. Start gentle masturbation every 3 days. Combine it with warm baths, relaxation exercises, and a session with a pelvic physiotherapist. 4 weeks later, he reported less general pain, better sleep, and a greater sense of control over his body. It was not a magical solution, but it was a process that helped him reconnect with his sexuality without harm. This illustrates that with medical guidance and complementary measures, masturbation can be integrated as a therapeutic tool. If you are undergoing treatment with antibiotics or taking medications that affect bladder function or sensitivity, discuss it with your urologist. Some drugs modify the response to stimulation and the coordination of the sphincters. Before changing sexual frequency or trying new techniques, it is prudent to review the medication and, when appropriate, adjust doses or times. Also, if your doctor is going to request a PSA, remember that ejaculation can alter the result in the 48 hours prior, so it is advisable to abstain before the analysis. To conclude, the practical and human recommendation: do not treat masturbation as a taboo or as the sole cause of your problems. If you have acute prostatitis, avoid the activity until it is treated. If you have chronic prostatitis or chronic pelvic pain, try it with moderation and gentle technique. Incorporate hygiene measures, subsequent bladder emptying, pelvic floor rehabilitation, and lifestyle changes such as hydration, less alcohol, and constipation control. Observe the response for several days and adjust according to what your body tells you. If there are warning signs or doubts, consult your urologist to personalize the strategy. Sexuality in old age should not be seen as a risk, but as part of life that deserves attention and care. With the appropriate guidelines and medical support, many men with prostatitis recover a satisfactory and guilt-free sexual life. Would you like me to summarize these recommendations into a short script for a video or a practical handout that you can take to your consultation?